Cracks in teeth. It's something that we see quite often at my office. I'm Dr. Brad Revering with Cross Timbers Dental, and today we're going to talk about cracked teeth and what to do about it. Here's somebody who came in and they had a tooth with a couple of silver fillings on it, and we see that, of course, all the time. The filling itself was starting to crumble, but if I were to draw an arrow right here, you'd see there's a small crack on that part of the tooth, and then over here there's another crack. And what I've seen so many times when there's cracks on opposite sides of the tooth, if there's a filling on going across the middle, if we lift out that filling, many times a crack is going to be going across there, and that's exactly what happened with this one. So again, I'm just going to put a couple of dots along here showing you where the crack is. It's right along that tooth. So you can imagine trying to chew on that, and it probably is going to break. I see it happen all the time where part of the tooth just falls right off. This person, the tooth didn't actually come apart, but definitely had some cracks. And what's even funnier about this case is that it had no symptoms at all. She was chewing on it, no problem, but we saw it and we said, you know, you may want to get a crown put on it. Well, they waited because, well, it didn't hurt. So why fix it if it doesn't hurt? Well, what happened was eventually it did hurt. And she wound up, you know, we got a crown put on it, but the nerve was already affected. And right here, there's an infection right there at the root tip, and there's another one right up there. So she ended up getting not just a crown, but a root canal in this case. So what can we do about this? Well, the sooner the better. We can get a crown put on that tooth. You can imagine physically it just holds the tooth together. If you wait too long, that crack just keeps getting deeper and deeper, and then it goes in through the enamel layer, and then it goes in through the dentin layer, and eventually winds up here inside the pulp. That's when it's a little bit too late. And if the really bad ones, they can go down the root, and then you end up losing the tooth altogether. So what we have patients do, they come in with a crack in their tooth. We put a temporary crown on that tooth while the final one's being made in a lab. If while they're wearing that temporary, if everything feels good, no symptoms, great. We just go ahead and put the final crown in, and they're fine. But if they start to develop symptoms over time, then they might need a root canal. If they are wearing the temporary crown, and they still have symptoms or symptoms begin at that point, we know that crack was pretty deep, and at that point, before we put the final crown in, we want to make sure that nerve is taken care of. And what I mean by taking care of, it means a root canal. But like I said earlier, if the crack is really deep, like in this example right here, or even right here, that's what we call a non-treatable tooth. That means the tooth actually has to come out. So what's the take-home message of this is if you have cracks in your teeth, you may want to strongly consider protecting that tooth by putting a crown on it to holding it together so it doesn't break apart. So that is today's video. I look forward to sharing more with you guys in the future. All right, take care.